Welcome to Knife Skills Live. My name is Dr. Rich Hills, and we have a very special guest today to talk about artificial intelligence and healthcare, and that is Harvey Castro. I'm going to add him right now. Dr. Castro, how are you doing?
Awesome. Hey, nice to meet you finally.
We've
Thank
been
you for
texting for a
having
little
me.
while, and it's great to just meet you in person. I've had a chance to watch you on some other shows, and you really are an expert on ChatGPT. Before we get started, though, why don't you tell us a little bit about your background, your training, and what inspired you to really become an expert on artificial intelligence at the bedside and ChatGPT?
Well, first of all, thank you for having me again. And a little quick background about me. I'm a serial entrepreneur. My training is in emergency medicine, ER board certified. Been doing it for about 20 years. And to give you a quick backstory, when the first iPhone came out, I was one of the first physicians to create the iPhone apps. My first app was called IV Meds, and it truly inspired me to basically see how I could use technology and use it in healthcare. And I was an early adopter. And so that explains why when ChatGPT came out, I saw the opportunity and I said, you know what, this is another tool that I think can help medicine. And so that's kind of what got me into this.
That's really awesome. Now, you have written a book about ChatGPT and healthcare, and I'm curious what it was about ChatGPT that inspired you, because there are other health AI innovations that have come out, and clearly ChatGPT seems to be something that's kind of unique and special.
Yeah, good question. So when I saw ChatGPT, it to me it seemed different from all the different AIs that are out there. We're all used to seeing, the AI that helps you read an X-ray or different types of AI. But when I saw this one, I said, this one is different because we're able to basically customize it. And it's not like Google where you ask it a question. You can be very specific and customize it for the questions that you want, and it'll give you an amazing output. And I thought this is an amazing tool. We need to talk about this in healthcare and help healthcare.
So for the guests, can you really explain sort of what exactly is ChatGPT? I think there are some people who still, although surprising, maybe unaware really what this technology is, how you access it, and really what it feels like to use it.
As many times I've been asked that question, I have such a hard time with that question. My best answer back is just let me give you a quick scenario so that can kind of explain by example. So, for example, if you went into Google and you said, I'm a diabetic and I need a really good diet, it would give you whoever had the best search engine or whoever paid the best advertising or whatever was optimized for that question SEO wise. And you really don't know what you're getting. You just know that you get that first page is what most people look at. With ChatGPT, you're able to ask the same question, but let me give you an example to show you the feature. So I can go in there and say, I'm a 50-year-old Hispanic male that has diabetes. Yeah, customize a diet for the next 5 days, breakfast, lunch, and dinner. And then when I enter, ChatGPT will actually generate that diet. And I know the first thing people say, like, Google can do that. But here's the interesting caveat. You can say, when it generates that, you can say, I actually have gluten allergy, I'm allergic to eggs, and whatever else. And then it'll exclude those things from that diet that we just talked about. But then you could take it to the next step and say, hey, ChatGPT, you go in there and ask, give me a grocery list of this diet. And it'll go back and look at all those items and give it to you. And then I can take it another step and you can say, help me prepare each meal. And it'll show you how to prepare that exact meal. And then the last thing I'll say, which blew my mind, you can say, I am in New York City this weekend and I need to follow my diet. What restaurants will help me follow this diet? And it'll give you a list of the restaurants for that particular diet. So all those things, it just kind of blew me away.
That's pretty cool. I think one thing about ChatGPT that impresses me is, and again, this is a feature, and just kind of blows my mind, is that it has this kind of internal memory when you're using it, that it knows sort of where you're at in the conversation, and it's almost a kind of a magical experience. And I think what you're talking about there, which is really cool, you can get some feedback, whatever it might be. Maybe it's a prescription or a diet or something like that, and then you can build on it in a conversational way. I think for me, at least as a user, that was the one thing that I thought this is unique and innovating. And of course, it gives you the illusion, at the very least, that you're getting a very unique and customizable response each and every time.
Yeah, agreed. Yeah, and I'm glad you just said that illusion because that is one of the, I think, problems with it in the sense that if you and I were doctors, this is actually my first time talking to another doctor about this. So I'm really
Oh, really?
excited to be on here.
Oh,
Yeah,
cool,
I've
cool.
usually talked to non-doctors or other professionals in healthcare, but not a doctor. So I love it because we both speak the same language. We both basically were trained similarly, and we have, I would think, the same goals, which is our patients. And so I feel like this already is going to be a different kind of talk. But to go back to your point about this hallucination effect of ChatGPT, this is why I preface with us being doctors. To the average person that may not be educated in healthcare to the degree that we have been trained, we can call BS on anything we read. We can read something and say, oh, from a medical point of view, like, no, that is wrong. This is not the right literature. It's hallucinating. And we can find those. And I'll take it to the next level. You and I are, I would call in the emergency room trauma. We know that niche. But if there was something very specific, and I'm going to make up something like in dermatology, and it would make a statement, you and I may be fooled. We may be like, that looks right to us because it's not our specialty. So that's what is one of the things about ChatGPT. You can ask it anything, and if it's not in your field and you look at it, you're like, this looks about right. It could actually be wrong. And so I want to make sure everybody knows that.
And that goes back to one of the limitations that I certainly noticed with the ChatGPT, and that was the issue of the fact that it, at least right now in this current version, is not giving you any sources, right? And of course, one of the things that we find as doctors, which is absolutely critical, is that we're looking for the quality of the source sometimes of the information that we're getting when we're applying it to patients. And again, there's a lot happening under the hood, I think, with ChatGPT in general. And maybe you can actually even just comment a little bit on like what a GPT is, like, and sort of what it's trying to do, because I think that answers the question of these sort of illusions that you talked about.
Yeah.
Maybe just mention that a little bit.
Yeah. So think of it this way, it's trained to give you an answer. It's trained to look into the database and literally generate an answer back to you. And it's not like quite like Google, in that Google, you ask it and it goes into the internet and asks questions. This is actually generating an answer specifically to you. And like you just said about your follow-up questions, it'll generate from that. And so one of the problems, like you mentioned, is this lack of references. And so because it's trained this way, I hate to use this term, but it almost feels like it's a salesman. Like it will always give you an answer. And it's up to you to understand that answer and interpret it and say, okay, yeah, this is wrong.
Very often it'll give us like a qualifier, for example, saying, "Oh, you should be talking to your doctor about this issue,"
Oh,
and
yeah.
that, and it's funny because when I experience that, I do see that as a little bit of a corporate speak, in the sense of saying, "Well, oh, this is like don't hold us responsible for whatever this AI is generating when it comes to medical advice," or the classic like YouTuber who does financial advice, or whatever. So this
Yes.
isn't financial advice. You see that caveat happen.
Yeah.
Um, but at the same time, then it'll give you this huge list of like sometimes very specific things, and you're like, okay, well, it's gonna be hard for someone not to act on that.
Yeah, and you brought up, 2 things that reminded me. I know that TikTok, I'm horrible with names, but the TikTok that came out of United Health, and a physician, a rheumatologist that basically was fighting the insurance company to use ChatGPT. At first glance, he looked at it and saw the reference, and it looked like a nice letter, and I read it, I'm like, "Hey, this looks good." But on further dive, and he came back later and talked about it, the name of the reference and the actual article did not match. And
Mm.
what was stated did not match the letter itself. But to the naked eye, he was a rheumatologist. He read it and be like, yeah, I'll send this into United. And what kind of from an ethical point of view and kind of interesting part, it would be if in the future United has that same chat GPT and the letters being sent, and then a computer is reading it and then sending a reply right back. So I can see that happening in the near future.
One example that reminds me of this is I was following another YouTuber who does a fair bit of kind of similar to me, who's an anesthesiologist or anesthesia resident, and he was testing Chat GPT versus his knowledge. And here's a good example of like of an error that Chat GPT was consistently making. So he asked ChatGPT the question, I'm going in to have a hernia repaired and I'm concerned about a breathing tube going down my throat. And so the response that ChatGPT got basically was, well, hernia repairs can be laparoscopic or open, but in the minimally invasive approach, you may not need to have an endotracheal tube, which
Oh,
is actually completely the opposite, right?
yeah,
When we do minimally invasive approaches or laparoscopic approaches for hernia repairs, we have to put a tube down the throat to get access to the abdomen, inflate the abdomen, do all
yeah,
that stuff. And so you can actually imagine a patient looking at that and saying, "Oh, well, I have an option of not having an endotracheal tube or even a general anesthetic to do minimally invasive surgery." And Chat
mhm.
GPT is giving a completely misleading and incorrect answer. Um, so I wonder about that, and then I'm starting to think to myself, maybe some of it has to do with how you ask the question.
I love that you just said that. So 2 points come to mind. One, it's all about the prompts, obviously. It's how you ask, and we're kinda biased because 'cause we're physicians, so we ask things a certain way, and we've been trained to look at things a certain way, so automatically our input is that doctor angle. Someone that's not trained, they're gonna put it how they see it, and their result from you and me even is gonna be different, but from us physicians versus non-physicians, it's gonna be different, so that's very interesting. The other part from an ethical slash just interesting thought is, I'm here in the United States, and obviously when I write a prescription, I know that when the patient goes to the pharmacy, he or she cannot get the prescription unless I wrote it. My
Mhm.
worry is, what if you go to a third, some other country, and a patient can just put in their symptoms, and all of a sudden ChatGPT says, the diagnosis is this, and these are the common drugs that you use for this. And then they go to the pharmacy, take the medicine, and they may be allergic, they may not know the side effect, they may interact with something else. I mean, a million possibilities, and God forbid they die. Now this has become an interesting, horrible dilemma for our patients.
Now I'm gonna play the devil's advocate though,
Okay,
and
do it.
think about it this way: is ChatGPT may be better than nobody when it comes to that environment as well, right? If you're in a situation where they have limited access to health providers, maybe ChatGPT can help them select an appropriate antibiotic, and it might be a life-saving
Yeah.
intervention as well. And actually, this is where I get a little bit excited, maybe about uh, Chat GPT, because maybe it'll raise the floor in some senses as far as what's available to
Yeah.
people.
No, I'm glad you said that. In fact, I've been thinking about the same thing, and I think this is why I'm excited about talking with another physician. I've thought the same thing. I think, I see a future, and I could be wrong, but I could see a future where certain governments around the world look at this and say, you know what, this is better than nothing. And I'm just going to propose the following. What if there's some kind of mobile device, some kind of I don't know, some computer station that they roll up to someplace in middle of Africa or somewhere that doesn't have healthcare, and it allows people to come in and just ask ChatGPT questions, and then it formulates, and then there's a local pharmacy or way to give them that. Like you just said, that's better than nothing. And so I think if you do that idea, plus if you could figure out to have a physician there with that, you could take care of so many people basically for nothing, which
Yeah,
is
one way to
amazing.
think about it would be physician extenders. And that would be something that's ChatGPT in a strange way is a little bit of a physician extender.
Yeah.
And, to stick on this theme a little bit, this is where I start to think about threats potentially with ChatGPT. And I don't want to get too political here, but
Yeah.
um, it may be flattening the difference between a mid-level provider and maybe a physician in some ways, right? If we're democratizing access to information, it may make the difference between someone who's got 5, 7, 10 years of training versus someone with 3 years of training, um, when it comes to actual bedside care. I'm not sure what your thoughts are on that, and it's definitely something I explored a little bit in one of the videos I created a little while ago.
Yeah, no, I love that statement. I believe in that. I think it's good. I think I see ChatGPT as my assistant, someone that can help me. And here's the beauty. All of us are not a robot. We're humans. We all make mistakes. We don't know everything. In fact, I always say this, every 72 to 74 days, the amount of knowledge in medicine doubles. And so the amount of information that we're expected to know, and if we miss X and Y, why not have this technology at our side that we can tap into and get the latest? And so I agree with you. I think I think it's a good thing. And then as far as like you said, having someone trained, I got to watch that video now that you made. But watching a physician versus a non-physician or PA that doesn't have as much training, having this access, I could almost make an argument that if the doctor's not keeping up, the physician assistant, depending what it is, they may actually know more because of their keeping up and their
Well,
reading.
and that's true. I think,
It could, in
that's
theory.
something that we all need to understand, I think, as physicians in general, is that, there's no guarantee that, we're gonna be the expert in that area just because we have MD behind our name. And so, of course, that is the fact of why I think in the last 20, 30 years has been such a increased focus on specialization.
Hmm.
I actually used to practice general medicine and then do primary care, family medicine, and then I retrained it as a surgeon and
Oh
then
wow.
focused on trauma and acute care surgery. And so I feel extremely specialized in my area. And that's really a way to cope with, in some ways, this incredible increase in knowledge that we've had over the past several decades. It's forced us into these somewhat small silos of care.
I agree.
So, we can look at it another way. Maybe there's a gap in our systems right now when it comes to really good generalists that aren't being filled. Here's your own thoughts on that.
Yeah. Well, I'm obviously biased. I'm an ER doctor, so I feel like I know a lot of a little, a lot of subjects,
But
but
I
the
want to
depth
comment
is
on that.
not.
I know the US is the same way as Canada. I mean, the reality is that very often people will use the emergency department as their
Mhm.
resource for primary care because they have barriers to healthcare structurally in many other ways throughout their lives. And so, again, this gets back to this issue of the reduction of maybe reducing some of those barriers and using technologies to help.
Yeah, and this is why actually I'm glad this is a great transition because literally this is why I push for this book called ChatGPT in healthcare, and I'm not pushing my actual book. I'm actually pushing the hashtag ChatGPT healthcare because this is exactly what I want to create. I want to find leaders like you, find patients that are obviously passionate about this, unite the two worlds, and literally I'm creating like a LinkedIn group to have people just have a discussion, and I'm inviting lawyers and programmers and out of all this, I'm not making any money, and I want to make sure I put that out there because I want you to understand this is all for us to improve healthcare. My immediate goal is if we can use this technology, like you said, we just came up with some amazing examples. Like, how amazing if you put a group of us all in a room and just talk about this. I mean, imagine the advancement. And then I'll say one last soapbox. I think that kind of pressure from a patient and us leaders will push the FDA to look at this. And I know they're already accepting different types of AI, but then they're going to look at this a little differently and say, you know what, this is going to actually help medicine.
Yeah, and I think it gets to there's a lot of ways we could think about this. I mean, I'm interested, and hopefully we can explore. We have a fair bit of time today to explore a little bit more on how we as doctors can better use it. But I guess something I wasn't thinking about talking about, and maybe you have some suggestions or maybe good advice for a patient who might be watching this and want to use ChatGPT to get some more information. Do you have any suggestions on maybe how they might use the tool or maybe what kind of prompts they might use? And I'll
Yeah.
just give you a little bit more of a example here. I'm old enough to have been in medicine when really Google was getting going. I started med school in 2003. And so that was a long time ago when it comes to these types of technologies. And we went through a period where patients like, oh, I Googled this and this was what happened, what I see online and that kind of stuff would like come with a piece of paper from the internet. I see a lot of that less now. I think there's like we've got this kind of equilibrium where I know patients are Googling and they'll kind of offhand discuss it, but it's less of like, oh, I don't know, WebMD's told me this and it disagrees with you. I don't see that very often anymore. So I'm kind of curious what you think, how you think patients might use it, or maybe if you have any advice for people if they're like logging into OpenAI to try
Yeah.
to use the tool.
Well, this makes me laugh. So I'm gonna date myself. I graduated med school in 2002, so I'm older than you as far as my
Yeah, sure, a
training.
little bit close though.
So close. So I do remember the days when I was a resident and Dr. Google would come into the room and the patient would say X, Y, Z. And I agree with you. I'm seeing a lot less of that. My advice to patients is as follows. You got to remember this is OpenAI and it's in beta, meaning it's still being experimented. We already mentioned some of the flaws. We haven't even mentioned it's not HIPAA compliant. There's the privacy laws, all that. But then on top of that, we don't know the reference. And then on top of that, the hallucination effect or just the wrong data that
Right.
coming at us. So my advice is as follows. If you're going to use this tool, be very careful with the output. And in my opinion, I know doctors are going to cringe on this one, but I would say whatever you're going to use, especially if it's going to be on you, then whatever comes out, you need to print it and bring it to your doctor or
Mm.
healthcare professional for them to look at it, just give their blessings. Because there's so many million computations that I don't know what you're gonna put in there and what's gonna
Right.
happen, and I would hate for a bad outcome from this. And so let's use this as a positive because that way we do better. So what kind of tips I would suggest is, here's a simple example I've been giving some of my patients. I'm like, before coming to the office, think of your diagnosis, think of your questions, but ask ChatGPT to maximize those questions to bring them to another level. So that way, when you come to the office, you know exactly what you want, but then you've kind of teased out the questions to the point where you know what really, and they're really strong, good questions and follow ups. That way, the office visit is going to be even better.
I've never tried that prompt. That's really interesting. So you're almost suggesting prompting ChatGPT to say, "I'm undergoing a hernia repair. What questions should I ask my
Yes,
doctor?"
yes.
It is. I'm curious. Have you tried that prompt and
I,
had some
I,
results with that?
I haven't, but I've taken it down, like, certain algorithms, like, someone that has, like, CHF and what diet and what should I ask my doctor, and
Mm,
it'll tell you. Um,
yeah.
and so just a general idea, I have, like, played with that idea, and I think it does work, and I think it'll be huge. And then the follow-up prompts, And then oh, that's the other thing I was gonna say. Depending on your population, meaning are you young, older, race, you could put that in to see what kind of questions come out. It may vary, obviously, like, the treatment of a kid is different from a treatment from an adult, and so those kinda prompts into the ChatGPT.
We have a comment here. I'm going to show it on the screen there from Alice Gray, who's curious, wondering about where this technology might be useful in pre-hospital care. I have some ideas how that could potentially be helpful. I'm curious on your thoughts.
I'm gonna play talk host right now, and I'm gonna ping it back to you. I wanna hear yours first, and then I
Well,
have some
here's
ideas.
the thing. I mean, I'll be honest. I mean, in my community, um, EMS, and I hate to say it, I mean, they do a great job, but our community, they use them as a taxi service to getting
Yeah,
into the hospital.
yeah, same here.
And, again, I don't know if ChatGPT necessarily gives a useful prompt for this, and this is actually, something that I'm realizing as we're having this conversation is that, there's so many things you could ask it, and it will give you an answer, but
Mm,
we do know that some prompts are better than not, and as I'm, like, proposing, I wonder if ChatGPT would be good at saying, "Hey, is this actually something I need to call an ambulance for, or can I go drive into the hospital myself?" That may or may not be it may not give a good answer to that, so I'm
yeah,
a little bit afraid to even suggest it.
I
But you
agree.
can imagine, I think we're okay to, like, imagine a future where ChatGPT gives solid answers for most prompts, and that type of thing could be very useful because there are a lot of problems where I'm like, you know what? Let's save the EMS for, in my world, the gunshot wounds, the MIs, the people who really need that, and of course the fallen effect. I'm just going to keep going on a soapbox here. We have a major problem with wait times in our emergency departments.
Mhm.
This just has echoes to our community because
Oh my gosh,
if
yeah.
if if the person isn't triaged into a bed, our EMS providers are with the patient the entire time
Oh,
until they're
wow.
triaged into bed. That can be hours.
Oh, I
So
didn't know
I'll
that.
show up in the middle of the night, maybe not middle of the night, but late at night, like 11, 12, dealing with the trauma. And I drive in, and my parking lot for the trauma providers is like right where the ambulances are. I'm very fortunate that I'm that close. And like there's just like it looks like every ambulance in my community is sitting outside the hospital, and I'm like, I know why they're there, because we've got
Interesting.
a 12-hour wait in emerge, and they can't actually like give the patient to the nurses, and so they're there still providing EMS care and not
Wow.
waiting for the more emergent thing, and so people are on overtime, and it's a real problem. So it's an interesting question.
Yeah, I'll give it a
Yeah.
stab. So I'm not going to promote any particular company, but there is a company out there that will actually, you can telemedicine in and say, hey, should I go to the ER or not? And you'll get a human being and a visit. And I thought, man, you combine that with this feature where you're doing both. what an amazing product for the patient, because that way the patient would be able to, I don't want to say self triage, but it would help triage them. But they actually have a human being, but you're using this technology. The second thing I want to bring
Right.
to light is at one point I worked at Parkland Hospital here in Dallas, Texas, and a long story short, they actually had kiosks that you would go in and say, these are the symptoms, this and that, and then they would help put you on the list of triage patients, and then the nurse would be like, okay, this one needs to be seen sooner, this one later, instead of having to go through the window and having a human being see you. This way they're seeing them all, and then the ones that they're not sure, they can call in as well. So I thought, what if you had that kiosk plus ChatGPT? They're in the facility, and then you can create kind of risk stratification, and then at the end of the day they're still responsible for them even if the computer messes up. So I thought this might be a really good use of the technology.
In that kiosk situation, did you use any AI, or is it really just a way to input and structure the history for the nurses?
The way I saw it done, it was risk stratifying, and it
Oh,
put in the
really?
symptoms, and then it would say, like, obviously, if somebody said chest pain, it would put it there. This was primitive. I haven't worked in a while, so I don't know what they're doing or if they're still doing it. But when I saw that, I thought, kind of interesting, kind of ballsy too, because God forbid you put something in and you miss, like especially those silent MIs in women that we always hear about. What if you miss one of those?
Well, and that's a great point. I mean, even in preparation for today's talk, I had some traumas last night, and I was kind of rolling in there and looking at the environment. I'm like, eventually artificial intelligence, and something philosophically will replace every job. And there's no doubt, including all doctors' job at some point. But you sort of sit there and you look at the chaos of this trauma and the people that are there, the emotional aspects, and you're like, boy, there's no way you're going to be pulling up ChatGPT to kind of help you make the clinical decisions right now. It's
Mhm.
this
No.
is like, rapid gestalt my gut feeling. Does this patient need blood products? Right. I'm not doing any calculation there. I'm making a decision, blood now or no.
Mhm.
That again, robots, I'm sure will be able to do that at some point. And we know that we're at this like frontier, I think. More to talk about that later, but we're definitely, you feel like, we're seeing more and more of this technology playing a day-to-day role in our lives for sure. But boy, some of those gut feeling things like you're talking about, again, does this person have an MI? Some of it's not just the ECG, right? Some of it's a
Yeah.
bit more about how they're
Yeah.
presenting.
I think I see a future kind of like when we see urgent care versus ER versus primary care. I see that in ChatGPT in the future. I do see a world where the hospital may leave a wing for patients that are being treated by ChatGPT. And I know that sounds odd. And so it's kind of these low trauma, not even trauma, low cases, primary care stuff that ends up in the ER just to help the ER be more efficient. And then they put a mid level there to kind of help ChatGPT or that kind of technology to say, okay, now this one's right, this is wrong. Come here, come there.
Yeah, in our community, we have, it's provincially funded. So the province of Ontario has something called telehealth, which I think
Mm.
is actually
Yeah.
underutilized.
Oh,
And
I
it was a
agree.
little bit what you were talking about. It's actually a nurse on the phone, and they have standard questions. And if they're answering certain things to certain questions, it'll prompt, yes, you should go to Emerge. No, you can go to your family doctor or a walk-in clinic or some other resource for care. Without a doubt, tools like ChatGPT can enhance that experience. And I think actually what will happen, and this is maybe where an entrepreneur like yourself, not really my shtick, but an entrepreneur like yourself could build a front end where you say, okay, these are your, it's a front end where you develop these prompts. It uses OpenAI's technology in the back end to, again, really triage patients to say, hey, this is something that can be handled at an emergency department. There's something that needs to be handled in a doctor's office. It's okay to wait a week for an appointment, or you should try to get an appointment urgently. Those types of feedback people might find very useful and helpful. You'd have to build something that was logical from the front end, but you could use, again, OpenAI's technology APIs as a back end potentially to do that.
I agree 110%. And literally, not to sell, again, I'm not selling my book. I'm just selling the idea of ChatGPT healthcare, that hashtag. These conversations, I bet you somebody out there is going to listen to this and say, you know what? I can do that myself. I can get a team together and I can make this product. So I wouldn't be surprised if this conversation sparked someone to create a business.
Yeah,
So,
and I hope so. Like
yeah.
I'm the kind of person who, although we always want to really get back to those caveats as to, you know, what's working, what's not with this type of technology. But I'm also someone who generally feels pretty positive about the future of integrating this type of tech. I'll give you an example of an area where I really wish we had better technologies. And ChatGPT, although it's not prepared to solve
Yeah.
this problem, you can imagine a future version or other machine learning companies taking advantage of this. And that is really good risk stratification for surgery. So
Mm,
we actually have the American College of Surgeons has a risk stratification tool,
mm,
and they use their national quality improvement program, NISQIP data. And so we're able to enter online, the age of the patient, their comorbidities, what surgery they're having, and a few other things. And it'll give us an output that tells us, what's the probability of them ending up in a long-term care facility after surgery? What's the probability of death or, other type of wound infection complications? And so that actually helps us strengthen their conversation because on the individual basis, I'm not really sure when I'm have someone right in front of me what their individual risk is for all of these very important outcomes for them. And it's nice to have this ACS tool. It's not a machine learning generated tool. They basically they have a massive database and used other techniques, regression analysis and stuff like that to come up with this. But you could definitely imagine, again, OpenAI type technology, machine learning, going into that database and mining that database to find patients that are just like the patient in front of you to give you a sense of what their individual risk would be.
yeah, no, I love that. I thank you for sharing that because my brain, my wife always tells me I'm always constantly thinking about a million things at the same time. So that's actually something I would enjoy working on. And the other idea is something that I think has an ability to actually go to market. I think with all these technologies, that's my whole goal. And I'm glad you're doing this too. It's just to get the word out, just to help us have these conversations. And the more we know of the technology, we already are in the problem, then the more we can hopefully fix that problem.
Yeah, for sure. And I think that gets back to again another comment that I made in that particular video where I talked about some of the threats maybe to the position that doctors have. We are privileged, and I'm grateful to be in that role. I was talking a little bit more about exactly that. We need to embrace these technologies
Mhm.
if we're going to be successful going forward. Pushing them away is a mistake. In my field, it's kind of interesting. Endoscopic treatments were kind of like ignored by surgeons, and same thing with cardiovascular surgeons. They ignored stenting and that kind of stuff and lost some ground in their area. And so if I have anything to challenge anyone who's a doctor watching this or anyone who's in a field that is potentially being threatened by AI, you're much better off embracing it, learning how to use the tool, developing a skill set when it comes to interacting with artificial intelligence. That'll be where your competitive advantage will be in the future.
I'm glad you said that. I told another podcast, no matter if you're in healthcare or not, this is like another tool, just like your iPhone or mobile device, whatever you use. And in the future, it's just going to be part of us. And not to go into brands and all that, but Bing has talked about adding ChatGPT into their Bing search. They've also talked about it being in their Office products. So if they're already doing that, then I could assume that when this ChatGPT API comes out, we're going to be bombarded with hundreds of different applications. So this is going to be with us. And so my point in all that long winded is that it's almost like the better you are with this tool, and if you're in a job applicant, then better than the other guy, then you're gonna or girl, then you're gonna be more efficient. You may even get the job because you're more efficient with it.
I'll show you this little comment here by Alice Gray. She said, "Eventually, ChatGPT may dispatch a self-driving ambulance to your place." So, I mean, look, if we get to the point where you can interact with the computer to call an ambulance, the ambulance drives itself, and robots are like picking you up to take you to the hospital. I mean, at that point, I don't think the world looks anything like it does today.
Mm-mm.
And that may be in the future, maybe not in our lifetime, but you can imagine a future where the humans are doing so little that the robots have completely taken over. But it would be a very different world if all of those steps are being interacted by computers. And I mean, really, when it comes to job replacement, I mean, massive amounts of resources are being used to replace the driver, right?
Yeah.
And again, and it's a good example of course, I'm a trauma specialist, and
So
I
you
had
see
a
it.
patient literally last night with a spinal cord injury from a car crash,
Oh,
and and it was related to substance use in one of the people involved, and so get people away from being behind the wheel will be a massive improvement in our society as a whole. I think
mhm,
there's like low hanging fruit some ways for technology in healthcare, and
mhm,
actually like injury prevention
mm,
might be the first real change, right? Because if all cars on the road are driving themselves,
yeah,
the amount of car crashes would decline dramatically, I think. It wouldn't exactly put me out of business, but it would certainly put me into a different category of work for sure. I'd be dealing with far fewer car crashes and maybe more, social problems. Which is still a good thing, right? Less
yeah.
in my world, the less trauma, the better.
Yeah. I'll add to your point, just as minor, if cars are driving themselves, you can make an argument that you don't need a HOV lane because all the cars are maximizing every inch and they can drive almost bumper to bumper because 'cause they're all talking to each other.
Right, traffic becomes less of a
Yeah,
problem. I mean, there's
exactly.
so
A
many
lot
other
of
things.
positives.
I think I'm not. I don't want to sound like I'm like promoting any particular company or whatnot, and I
Yeah,
won't. I won't do that. But what I will say is that like it does change our lives in a huge way. This one issue of driving cars, because then actually even vehicle ownership becomes less of an
oh,
issue.
yeah,
We spend less money on transportation because uh, why do we own our cars? Well, we own them so that we have a convenient
yeah,
transportation. I can walk down to my parking spot and take my car out from my condo anytime. Uh, well, with self-driving vehicles and the availability of a car right there,
mhm,
um, automatically without me having to own it or take up a spot would be massive, and it would change things completely. So
yeah. Well,
I'm not.
I gotta jump on that one because I told my son this. I go, "By the time" he's, like, 19 right now. I said, "By the time you have kids and your kid is gonna be driving, I guarantee you're not gonna buy him a car because what'll happen is you may buy a car or you may end up doing something like a subscription base where you
Right.
pay and then it's just a car down the road and they'll come pick you up and then it's automated." Back to Allison's Gray's point and your point, I actually do see a future of an ambulance sooner than later, and let me explain. You perfectly said there's a lot of people that come through ambulances that shouldn't have been coming through.
Mm.
I see that being the case where, it's someone that's a recurrent, someone they may be with something minor, that an ambulance, quote, automated car will come pick them up and not have to lift them. And as long as they can get in the car themselves, it'll kind of be like a taxi, but they'll call it an ambulance. I actually see that coming sooner.
Yeah, it's like
Obviously, not
you
this
could.
year, but sooner.
Yeah, ChatGPT asks you the question.
Yeah,
You say, "Can you walk?" "Yeah, I can walk." "Okay, okay, perfect." Then that's step one, right?
yeah.
We can get you to the hospital.
Yeah, if it's low
Um,
triage,
yeah,
yeah,
the question then would be, what other, and this is the fun part. And this is actually where I really want to spend maybe the last 20 minutes of our conversation is talking about those frontiers, the future, which I think is really, because we know you and I, we've talked about it. ChatGPT is a fun tool right now, but it's at the present iteration, it's not quite there to be that actually useful for healthcare for the most part. I
mm,
think that's, unless you want to challenge me on that a little bit. It's your point. And we want to emphasize it. It might trick you into thinking it's a good answer when in actual fact it's not. And only with me looking at it from a specialist perspective, do I see the real problems. When
mhm,
I'm asking questions outside of my specialty, as you mentioned, maybe I'm missing the fact that there are some important details that are incorrect. But we can get excited though about the future. And I think
yes,
that's what I
agreed.
really want to talk about here. So let's pick up on Alice's comment about this self-driving ambulance. I wonder what therapies can you imagine would be available in such an ambulance, assuming that there wasn't necessarily humanoid robots that could be part of that. Any thoughts there?
Oh, man, my mind just blew up. Oh my gosh, you could put so many toys in there. I'll give you a couple. I don't know if you knew about this technology. There's actually cameras that will tell you your temperature and your blood pressure. I mean, temperature has been old, but the blood pressure one's new.
Really?
Yes, and
Cool.
so I imagine a world where you come in and it's got this infrared, it knows your temperature, it knows your blood pressure, it may have you hold on to something and it knows your heart rate. Right there, we got most of your vitals already.
Yeah.
Hold something else, it tells you your oxygen level, so
Right.
in
Sending
real
that to the
time.
hospital that's receiving the patient, they know if
Yes,
this is
in
gonna
real
be
time.
someone who's concerning or not.
Yeah, and
Starting the
what's
triage
interesting.
process right there at the ambulance.
Yeah, we're not far from that already. We just got the
Yeah.
problem is, from a I'm gonna put my business hat on, it's more cost, efficient in that it's not cost efficient right now. It would cost so much to put all that technology in a self-driving car and have
Right.
it go and liability, but here's the beauty, this technology is going quickly and it's doubling very fast and it's
Yeah.
getting better and better, so who knows if what this conversation we're having, we may have another one in a few years talking together and be like, "Do you remember when we had this podcast together and we talked about this?"
Well, I hope we do because I think, again, we wanna be part of the, um, solution, is that the right word? We wanna be involved in how these technologies impact patients when we're taking care of them, and it's really important. But yeah, so the idea of those technologies being sent back, but again, business hat, if we want to think about it again for my community, it's a little different because we're in I'm Canadian and we're in a publicly funded system. So the EMS is run by our government. There's nothing private at all about this, and on really any of the tiers of care. But an EMS trained person earning a decent salary, spending 8 hours of a shift in an ER while they're trying to offload a patient, and literally they'll be like, they'll end up handing over to another EMS crew that'll drive over to the hospital to hand over to take over the patient because they're off shift. Happens in our hallways of emergency departments. Like, it doesn't take it's very easy to imagine a world where that's economically inefficient
Yeah,
and technology can replace that.
agreed.
So we have a comment here. I haven't even read it here. Sorry, late to the stream. I'm curious if there are any promising assist only versions of AI software machinery that you're both looking forward to. So promising assist only version. I'm not sure what's meant by that exactly, but thank you for the comments, Cedric, on
Alright,
loving the
I'll
videos.
give it a stab. I think I know what Cedric means. First of all, thanks for coming in and talking to us. And so I did see something that kind of blew up my mind, and it's called a company called Pons. And basically, what they've created is think of it as an ultrasound, and it's guided through AI. And so, if you're wanting to screen breast cancer, the idea is you would be able to do the ultrasound, but then the AI would be like, okay, you have to hold the ultrasound probe like
Gotcha.
this at this angle, and then it would take pictures. And I know this is all prototype and pie in the sky thing, but it is coming. And I thought, wow, what an amazing idea to start doing these kind of tests. And traditionally, you'd go to the hospital, but maybe you can go to the pharmacy now and get this done, or maybe your doctor can have a room and you go in and they slot so many hours and you're doing it yourself. I mean, you don't need a human being; it's literally guiding you through it.
An example that I can think of to try to dovetail on, I think what Cedric's getting here, might be the role of robotic surgery a little bit.
Oh,
So
okay.
right now in robotic surgery, the Da Vinci system is a really dominant technology that we're using. There's actually no AI in that at all, really. Maybe it's something on the optics possibly, but the no computer's making any decision. You're moving the camera around yourself. You're manipulating the instruments yourself. But you could imagine an AI guided system that moves the camera on its own. So it's giving you the optimal picture, for example. And so you can just focus as a surgeon on actually manipulating the tissues instead of, moving the camera. It's actually a very cool system to interact with where you could just like use like a clutch pedal and then you move your hands and moves the camera and then you release the clutch pedal and you're back to using your instruments. Very, very cool. But there's very, very little, believe it or not, AI integration with Da Vinci systems and intuitive surgical systems. So I think there may be opportunities for that in the future. I love the ultrasound idea. Again, AI could help you with optimizing image generation. So here's an example.
Mhm.
When I do a podcast or I'm making a video, I'll send my audio into Adobe, and Adobe uses this AI technology to kind of improve the quality of the speech, and it does an
Mm.
awesome job. When
Wow.
we're doing ultrasounds, if you think of a bedside ultrasound in the emergency department, trauma, whatnot, there's always this gain balance that you have to figure out to optimize the image depth gain and all this kind of
Mhm.
stuff. And you're sort of making
Yeah.
the judgment. I'm adjusting the depth, adjusting the gain, trying to optimize my image. You could imagine where you have AI say, hey, I'm looking for the gallbladder or I'm looking for the liver or whatever. and then the computer's like, okay, I'm going to give you the right depth, the right
Yeah.
gain to give you the best image. And that would assist, again, an ultrasound tech, an ER doctor, or anyone with the tools we're already using. It's a pretty cool idea there.
Actually, I'm gonna up you one. I'm not gonna mention the brand, but there is a brand out there that you buy this little probe. I want to say it's like 2,500. You add it to your iPhone and you open the app, and you can do ultrasounds, and it already does all the adjustments of the gains,
Oh, does it?
imaging,
Is that Butterfly?
everything.
Is that the
Yeah,
company, or is it?
Butterfly. Yeah, it is.
Yeah, yeah, okay. Yeah, well,
Yeah,
I wondered. I have some familiarity with them. So maybe, yeah, maybe they're actually incorporating AI technologies into their
yeah.
system already,
And
which is
so I
pretty
thought,
cool.
"That's
So,
amazing," 'cause I went through the time when I was trying to do ultrasound, and I hated messing with the gains and profiles and all that. I was like, "Oh my gosh, I rather just do spend more time on the medicine," but just this technology part, I hate it, ironically.
well, and that's exactly it. It's like it's just another like skill and thing to play around with, and it can slow your interaction with patients. I'll just pull up Alice's comment here. It says, how's good AI with dealing with drunks? And maybe better than you think, actually, because one of the challenges that could happen, although this is really off topic, but I think it's interesting. One of the challenges that some doctors struggle with, and I think this is the cornerstone of professionalism, is this idea of taking the emotions out of the interaction when it comes to the patient. Lots of times you'll deal with the victim of someone who was shot and the shooter,
Yeah.
right? And you'll have
Yes.
responsibility for both of them,
I've
right?
done that, yeah.
And that's happened many, many times in my career. Being a professional means taking the emotions out of it.
Yeah.
But it's hard. It's hard, and that weighs on you. Even losing that bit of humanity weighs on you. Whereas you can imagine a world where more technology assistance can help you um, uh, take away that emotional aspect. On the other hand, and this gets back to the self-driving issue, is that sometimes if we put computers in making ethical decisions, are how comfortable are we with that? Any thoughts on that, Harvey?
Yeah, no, so many things come to mind. I'm gonna go back to your first point of the empathy as being a physician. It's you and I are basically in the same spot in the sense that we're seeing the trauma, and then how hard is it from an emotional point of view going into and seeing a patient that just got shot and tell the parents that their son died, and then
Right,
going into the next room and it's a strained ankle and it's nothing. You got to act
right, right.
100% like unaffected, and so from a emotional IQ, it takes a lot. And so I agree in the sense that, yes, it would be nice to have an AI there to help at least with the triage or peripheral brain. And I'll take it to the next level. Last night you worked, but what if it was 4 in the morning and you're not quite at your best? Wouldn't it be nice to have another assistant that's saying, hey, I would order this test and I would recommend XYZ. And there's times as a human being, I know you've been there where you're on the fence, like, should I order this test? Maybe,
Mm,
maybe not.
yep.
But then if you had some algorithm that said 89% of this is the probability of this test, this, and then you look at the numbers like an equation, you're like, huh, okay, yeah, I actually probably need to order this test or I need to rule this out. And so back to the human versus not human, the bad part of AI is it has no emotion. And this is where it gets ethical and crazy. We're doctors, we're empathetic, we love our patients, but here's a robot. And would you want to hear a robot or something telling you that your loved one died? I know that we're not
Mm,
there,
yeah.
but something along those lines, or some diagnosis that you rather hear it from a human being, or something like that, or something. Or what if the ChatGPT said, "Oh yeah, this sounds like cancer, blah blah, blah this," and you're like, "Holy cow, I need to see a doctor now." It's like, so those are the kind of ethical side from the AI that it's kind of too cold and it's not human for us.
That makes you laugh because remember when WebMD came out and like everything was cancer. Like it was
Yes,
like
yes,
I it cough and like the differential like in cancer people might have cancer.
yes. I
Uh,
do remember joking around in the ER with those. Like,
that was
really?
always the funny thing with WebMD. I will say ChatGPT does a little bit better job at that. Like it doesn't like it's smart in that sense. It is a good communicator because
Mhm.
you're on it and you're not like, oh, like am I dying? Like if I put a symptom in there, it's very soft and gentle. Maybe to a fault though. It's like, oh, maybe I get false reassurance. Oh, my chest pain. Oh, it could be a heart attack, but maybe it's just like
Yeah.
reflux. It's like,
Oh my gosh, you just gave me a quick idea. Supposedly, ChatGPT 4 that's supposedly coming out later this year. And again, one of the rumors is that you can show it a picture, and then the ChatGPT will look at the picture and then give you an output. I'm making this up, but what if you showed a picture of a patient that's jaundice,
hmm.
and ChatGPT could say, "Oh, this person may have liver disease, may have this
Yeah.
disease, may have blah blah blah. Like, think of all the algorithms, or showing them a mole that already exists, and it looks at the mole and says, asks you some question, and tells you, yeah, it could be this. So I see that coming soon.
Yeah, those physical findings, for sure would be something. I mean, you can get so far to say, like, listening to heart sounds or something like that
Oh
as
yeah,
well. My one caveat, though, kind of interesting. I mean, we've had computer aided decision making on ECGs for a long time, and
hmm
even predating me in med school. But they always said, well,
yeah,
you can't
read
totally
it.
rely on the
Yep.
computer. Um, and what surprises me is that, well, that was 20 years ago. By now, the computer's got to be better than we are at that. No, like for real, and we're still reading ECGs as humans.
Yeah. Well, you make a good point, and I'll challenge all these non-specific findings that we always put on the chart. Is it non-specific to us? And we just put it down as
Right.
non-specific, but it's really specific for something else, and we really need a true cardiology expert to know, oh no, this is actually this syndrome or that, that we don't know about. And that I bet the computer could recognize faster than we could.
And again, one of the things that's interesting, because your world's a little bit different than mine, and one thing we say about emergency medicine, which is special, is that it is one of the most decision dense specialties in medicine. Meaning, on a per hour basis, the number of choices you have to make as an emergency doctor is way, way more than most other types of providers. So as a surgeon, right, I'll
Yeah.
see a few patients in consult, but really most of the patients in consultation, even though I'm pretty busy, are very, very much within my area of expertise. So I'm not making a lot of choices. It's like, yeah, you
Yeah.
have a hernia, we need surgery or not. In
So
the
that makes
operating
sense
room,
because they've been
there's
kinda
lots of
triaged,
decisions, but it's
and they've seen
scrolling.
multiple doctors before they see you, and then
Yeah.
by the time they see you, then if they ask you a question, it may be like, "Is it this or this?" But they've already kinda narrowed it down and say, "Here you go, and here's all the
Right. I've
data
got
behind it."
tests, CT scans, all these
Yeah.
reports coming in, and yeah,
I
it's
never
not
thought
like.
of that. Yeah.
Right, exactly. So I wonder. So for me, it's not like missing something in my own specialty is pretty unusual. Like it happens. We're all
Yeah.
we're flawed for sure. But for the most part, if someone comes in, a good example would be rectal bleeding in my clinic, which has a pretty big differential that could be completely benign, hemorrhoid, or it could be cancer, right? So it's got a bad differential. But like our approach to that is really, really algorithmic from a general surgical point of view. That's not so easy in emerge. There are a lot of algorithms in emergency medicine, but boy, there are a lot of things that are really undifferentiated that come in, right?
Yeah.
And makes you wonder if this type of technology might help reduce the error rate in a specialty like yours.
Oh, for sure. I give that as an example all the time. I feel like my same example always is, middle of the night when I've worked 30 hours and I'm exhausted. Obviously, I'm not at my best. And so wouldn't it be nice to have that peripheral brain helping me, or even when we're sick or we're not our best and we're
Yeah.
there trying to help. But then again, when pandemic came, how nice would it have been to just have that extra tool to just help. To your point earlier, you got to put up Alice's Gray's last question there because
Yeah,
I think
absolutely.
it's a
Let's do
great
that actually.
transition actually to what you just kind of talked about.
Yeah, so she said, "What about the issue of AI accidentally promoting bias in medicine?" Well, actually, Harvey, why don't you talk a little bit about this? Because this was actually kind of something that I think you and I both discovered probably when ChatGPT came out. Is there maybe some hidden biases that were being revealed? People kind of had gamed the system and showed some hidden racist possible
Yeah,
tendencies of ChatGPT.
yeah. So I agree. I think obviously, and this is more of an ethical question. When research is done, some of the research is done and paid by it. It gives attention and helps certain populations in the world, and those populations are reflected in our studies and are reflected in our data. It doesn't quite get the same attention sometimes to other populations, or at least they're not represented as much. And so when you put that data that it already is biased, it's mainly showing a few populations and not showing other ones.
Well, let me give you an example. In
Yeah,
surgery, there's women are very underrepresented in surgical research.
perfect. Good
So,
example.
so you're absolutely right. So what's the output going to be on risk for women? So one of a great example is there's this big study that was non-operative management for hernias in men for who people didn't have very many symptoms, like minimally symptom or asymptomatic hernias, and basically said you don't have to operate on everyone. But the only people that were included in that study were men. So how like so there immediately there's a bias in the data, and you're absolutely right. If all these technologies are doing are mining data, and we're inputting systematic biases into the data, we're gonna
Mhm.
have bad outputs.
Exactly. And so, and that's exactly what's happening. And then the hard part as a doctor is we don't know where the references are. We really don't. We don't know if ChatGPT just made it up and said there was a study, or if there really was a study, or if it's quoting the right study. So, I hope and think, and this is wishful thinking on my part. I'm hoping ChatGPT 4 addresses that.
Mm.
And we haven't even talked about Google and
Yeah.
what they're doing, but I think to keep it short, I think Google's gonna be having the references and what we're looking at in medicine, at least. I think that's coming sooner than ChatGPT, but I could be wrong. If they start doing ChatGPT 4 with the right references, then
Yeah.
it's a tie.
Who knows? And I think, yeah, it's a great point. Like, there'll be competitors emerging for sure out
Mhm.
there, and that's something maybe we can talk about another one.
Yeah.
We are getting close to end of time, and there's some great questions here, though. I want to get a
Oh,
chance
yeah.
to ask them. So this one here, I'll take it on a little bit. This is from Rand Dev talking about, what about AI integration in like Google goggles or VR goggles in the operating room? So I've actually done some research. I have a paper where we did some telementoring on performing fasciotomies remotely using
Oh,
Microsoft's HoloLens. And
wow.
basically, we used PAs, not PAs that are surgically trained, because many are, but PAs that worked in primary care clinics. And we had a orthopedic surgeon guide them through fasciotomy performing on these task trainers, these models for performing 4 compartment leg fasciotomies, and that was really successful. And one of the publications I'm proud to be involved in. So
Wow.
there's definitely a role for these type of technologies in the future. I think telemetry makes a lot of sense, because what it allows you is for me as a surgeon to see what the other surgeon's doing. So you can imagine a rural or remote surgeon with a problem in the operating room calling a specialty center like myself and getting some right up to the minute advice. Or before you cut the bile duct,
Mm.
get another surgeon's second opinion right in the operating room by pulling on a HoloLens, and I can say, oh, don't clip that, for example. Might be some way that we can use that technology.
Yeah,
Maybe not so much AI integration, but using this metaverse concept. I mean, a
yes.
lot of what we're talking about today is like, what's the possibility for the future? It's not just ChatGPT, of course, but that's the one of the current frontiers, right?
Yeah, I saw 2 companies, and I'm horrible with names. So, but basically one of them was, it showed, 3 or 4 different surgical site areas in the world, and they were all giving second opinions in real time. And then it was just amazing to me, because I thought, "Man, you could be in Italy giving advice to some surgery that's going on in Miami and vice versa," and I thought, "What an amazing idea." And then I saw a graphic of a picture, and it looked like a hologram, and then this company was kinda showing what was being done, and kinda like in 3D, and then people around the world could kind of follow the surgery and have medical students, and I thought, "Wow, what a tool." Like, if you had that kind of information coming in real time, you could, like, save a life, or do, like you said, the right procedure, like, "Hey, don't cut there," or, "Hey, no, that's not what you're supposed to do." So I thought it was amazing.
For sure. Actually reminds me a little bit of back in the day, they used to call surgery ORs theaters, because people would be like
Yeah,
watching what was happening.
I do
And
remember that.
again, these technologies can revolutionize medical education
Oh
by
my god.
having people like right there, right next to the surgeon. And I'm sure you remember back in the day with medical school, and of course I'm now the surgeon. The med student, you're holding this retractor,
Oh,
you
yeah.
can't even see like what's happening in the operating
Um,
room, and you're literally I really would love to see what they're doing, but I'm just like hanging onto the retractor. uh
mhm.
it'd be
And
nice
you're
just to
lucky
have
to
the
sew up at the end. That's the prize at the end. It's like,
it's worth it though. It's worth it
yeah.
because you do get to develop that little skill.
Yeah.
We're almost done. I want to pull up Cedric's comment here. Appreciate his comment from earlier. But do you see any changes in training that might be useful? Again, thinking about these new technologies. Yeah, and Harvey, I'd like to get your thoughts on again. Should we be thinking about how to train doctors to use ChatGPT or these
Oh my,
tools going forward?
yeah. In fact, I read this the other day. Only 3 to 5 medical schools in the whole United States teach AI as a
Hmm,
class in medical school. So
really?
to speed the process, basically, I come out, I'm graduated, but then you're throwing all this AI, but I don't know how to use it. I don't have any ethical ideas, questions. Like, there's a lot of things that you really should know, especially if you're going to use this technology. As far as use with ChatGPT specifically, on this part where I'm excited, I wish I had this growing up when I was in med school, but you could dump, let's say, a chapter of Tintinelli or some medical data and ask it for summaries. So then it would say, okay, here's the cliff notes for this. You could put like a certain topic into it and say, hey, make flashcards for me.
Hmm.
So those are kind of interesting ideas. And then the clinical case we haven't even talked about, but passing USMLE, step 1, 2, or 3, being able to dump cases into it and learning by it and saying, okay, here's a patient that presents XYZ, explain the rationale behind this. And then it will tell you the diagnosis and kind of walk you through why it picked that. What an amazing tool. It's like having a tutor available with you. So I would think, man, that would have helped me so much through residency and undergrad and all that stuff.
Yeah, I've seen some people use ChatGPT to answer multiple choice questions and pass exam questions. So there may be some value in a tool like that as far as like checking your answers, or if you're, like you just said, you're not sure exactly why one answer is better than the other. These types of AI technology and tools may be helpful. And again, getting back to this idea that although I'd be very surprised if med school is going to integrate this technology quickly. And here's my thing. I'm fortunate enough to be an academically appointed surgeon. I teach in the medical school.
Mm,
And, I'm very familiar with how decisions get made. Med schools are so far behind when it comes to technology. The reality is that we don't teach enough ultrasound, for example, in med school, but we're still listening to spending all this time listening to lung sounds and heart sounds and things like that. And there are better tools available. So med school is notoriously behind the curve when it comes to teaching technology. So
mhm.
I'm actually less hopeful that medical school will be embracing that anytime soon. But I will say the young doctors that watch my channel, there's actually quite a few of those. That's a lot of my content's centered on people who are interested in medicine and want to become doctors. I would strongly encourage them to get comfortable with this technology now, develop a skill set now,
Mhm,
because it's going to be upon you to be competitive in the future environment.
mhm.
And if you leave it to medical school to train you on technology, you might find yourself a little bit disappointed.
I'm gonna challenge you on this one. I think if enough medical students and they already are into everything mobile and different lifestyle, they eventually will be leaders. They eventually be the deans of the med school, and they'll eventually change the curriculum. And with that said, if there's as much power in the doctors or medical students pushing for something, I see that coming sooner than later. So that's just my 2
Well,
cents.
and I'm going to agree with you here. In one sense, is that when I was in med school, I remember we actually kind of had to memorize dosages of things and stuff like that. Well, that was probably the first shoe to fall in our world. Is once we had phones in our pocket that we could look up drugs, the that whole area of trying to memorize drugs, even side effect interactions, just kind of
Yeah,
fell away, and
yeah.
we freed up cognitive space for other
Mm,
areas to learn. And that happened sneakily in a strange way. I don't think we
yeah.
realized that happened, but the way we learn medicine is different now
Oh,
than
yeah.
it was before the cell phone.
Yeah, I agree. I won't go into details, but when I went through med school, it was all problem-based learning, and at the time, that was an experiment. It was just
Yeah,
me and 20 medical students
right.
in that curriculum, and it was experimental, and I had to sign a waiver saying, "Okay, this is how I wanna learn medicine." But now it's being adopted everywhere. That's the way it's done.
Well, it's pretty cool. I actually, I have our kindred spirits. My university was an early adopter for problem-based learning as well. But what's so
Nice.
interesting, I'm a professor at a different school than I went to med school at. The pandemic had a massive impact on pushing more of that problem-based learning into our school. And the
Interesting.
differences between how I learned and how we're teaching the med students now is like very, very small. It's all become that.
Yeah,
So yeah, medical schools can innovate if there's a pressure to innovate,
exactly,
and
and that's
maybe
my
this type
point.
of thing might be enough.
And that's why the sign behind me, ChatGPT Healthcare, so we're gonna be pushing this so that our administrators make some changes.
You know what? We've been on the phone here for about an hour. It's been great, and I really hope, Harvey, that we have an opportunity to interact again. we're just scratching the surface here. There's gonna be new versions of GPT coming
Oh,
out
yeah.
and new challenges, and so I'm really excited about that in the future. I know you're trying to downplay your book and that kind of stuff, but would you be willing to put a link to your contacts maybe in the text chat so
Yeah, of
anybody
course.
watching this video at home or playing it back later can find you?
Yeah, of
Um,
course. Yeah,
and
just
I will add your LinkedIn to the description of this video later today when it is available for people to watch it as a repeat. If you don't mind even putting that in the chat now, that'd be great. We really want to get people to find you and what you're doing. It's awesome that you're educating both patients, the community, and doctors about this new and emerging technology.
yeah. I'm just gonna say real quick, just jump on Amazon. I'll put that in there, but just go on Amazon and type in Harvey Castro and MD, and it'll show all the books I've written, but that's the latest one. So yeah,
Awesome.
I really appreciate you having me. I sincerely do, and thank you. We gotta do this again.
We had a lot of fun for
Yeah,
sure.
that was fun.
Absolutely. Great. Well, have a great night. And once again, thank you everyone for watching Knife Skills. We're here for you. And please tune in to the next time we run live. Have a great night. Bye.